Welcome back to episode 9 of Let's Go Shorts, where we teach you how to be more comfortable and competent to care for your patients with obesity. I am Dr. Peter Ammon, a medical bariatrician in Portland, Maine. Today we will learn more about weight loss surgery. Surgery can be a very effective method to treat obesity in patients. For the past few decades, guidelines suggested considering surgery for patients whose body mass index was above 40, or those patients who had a lower BMI but above 35, who had at least one obesity-related condition, such as hypertension, diabetes, or sleep apnea. New guidelines released in 2022 more strongly recommended surgery as the optimal treatment for patients whose BMI were 35 or above, regardless of comorbid diseases, and to consider it for individuals whose BMI was above 30 who did not achieve substantial weight loss or obesity-related disease improvements with non-surgical methods. This could include children and teens. The guidelines suggest that surgery is currently the most effective evidence-based treatment for obesity. Multiple studies have shown significant improvements of metabolic disease and decrease in overall mortality, and newer surgeries are safer and more effective. Yet only 1 or 2% of eligible patients have weight loss surgery every year. Studies show weight loss surgery could be the most effective treatment for type 2 diabetes. It may reduce the patient's risk for premature death by 30 to 50%. And surgery is noted to be as safe or safer than gallbladder removal, appendectomy, or knee surgery. However, any surgery can have risks. The risk of dying within 30 days of a weight loss surgery is quoted to be about 1 in 1,000 patients. The risk of major complication is quoted to be 4%, and this can include bleeding, infection, anesthesia reaction, blood clots, leaks, or lung problems. Studies have shown a 30 to 40% overall weight reduction 6 to 12 months post-op. On average, 5 years after surgery, patients maintain 50% of their excess weight loss, and there are significant remission rates documented for multiple diseases, including type 2 diabetes, hypertension, sleep apnea, and cardiovascular disease. The 3 surgeries that are currently offered through our program include the vertical sleeve gastrectomy, the Roux-en-Y gastric bypass, and the SADIE, which was new in 2024. In order to qualify for weight loss surgery with our program, patients need to be non-smokers and nicotine-free, and both medical and psychiatric conditions need to be under good control. Patients will meet with multiple team members over a 6-month or longer period, including medical providers, dietitians, behavioral health specialists, and the surgeon. They need to be up to date with usual age-related cancer screenings. Patients will often have an upper endoscopy and a sleep study. Patients can expect 1 night in the hospital and are usually back to work in 2 to 3 weeks. They need to continue lifelong vitamins. Some patients struggle with weight regain. Risk factors for weight regain include patients who eat constantly throughout the day or continue to graze, those patients who drink a significant amount of calories, patients who are sedentary or not able to exercise, patients who have poorly controlled mental health conditions such as depression, anxiety, bipolar, or sleep issues, and patients who need to continue to take medications that can increase appetite, such as steroids, insulin, some of the mood stabilizers, sleep medications, and certain blood pressure medication. Weight loss surgery can be a very effective treatment for obesity, and patients will often lose between 30 and 40% of their initial weight, which could be well over 100 pounds. In order to be successful, patients will need to continue to follow their post-op diet and should regularly check in with their weight loss team and other providers. Studies have shown a significant improvement in quality of life for patients who are successful after their bariatric surgery. One study showed a 7-year mortality was decreased by 40% compared to non-surgery patients, and there was a 92% decreased risk of death from diabetes, 50% decreased risk of death from heart disease, and a 60% decreased risk from cancer.